all my life. And the
Good afternoon, my name is Ivan H. Lee. Studying Master of Arts in Nursing, major in Adult Health in the University of the Philippines, Open University. I am recently working here in the Rockpocket Medical Center Incorporated, Quezon Province, as a charge nurse. Hello sir, I'm here to ask some questions regarding nursing administration. First is, as an administrator, what are your motivations of becoming an efficient leader?
As an efficient leader, I use the Maslow's hierarchy of needs. I should attain the 5 levels of it to be able to motivate me as an administrator in this institution. Initially, I see to it that I achieve the physiological needs. It is where I should feel comfortable in my hospital environment, a good strong building, and the ambience of the hospital setting itself. Second, I should feel that I am safe and secured in this institution. There should be proper lighting. My personal belongings are intact and well kept, and the security of financial tenure should be also observed. Third is my social affiliation and belongingness to the society. It is my opportunity to be able to interact from my subordinates and my colleagues as well. Thirdly is the achievement of my self-esteem. It is to know the wellness of my subordinates, the recognition of the institution to the effort that I have made for them, and last is the self-actualization. It is where I can outgrow from this institution for my professional growth and my continued education.
So what do you think are your leadership qualities that placed you in a managerial position?
I can say this in my humble words by saying that I should observe to be proactive in this institution, looking ahead before the problem occurs, be flexible enough in different situations, be respectful. It should be that I should respect also others as an empathy. Then I should observe a quiet confidence to be able that I can disseminate factual information to them. Open-mindedness is very important so that I can analyze every situation and not looking for my own safe and my own ideas. I should be also interested in their different feedbacks or comments, whether it is positive or negative, so that it is a big help for me to uplift my self-confidence and to renew my bad attitudes that I am not observing within me. Then last is to be organized, to be able to run the nursing service institution very well.
So how do you use your critical thinking and decision-making skills? In what specific situation do you apply it?
As a nurse manager, I weigh both sides of the parties very well and be able to come up to a decision which is fair enough for the good of the most need. I analyze the situation well and create a justified decision, implement the structured plan, and evaluate the outcome of the decision that I had made.
So how do you utilize technology in this process?
Based on the latest trend of our society, the utilization of technology is very much adept to our environment as nurses. This technology applies not only in medical reasoning but in nursing reasoning. It helps us to assess in different client circumstances or problems and be able to recommend appropriate nursing process or nursing intervention. Ethically, we should apply this to our clients whether they will accept or reject those kind of process technology that we have gained from the modern times. Their suggestions are very vital so as to build rapport with them.
And of course, we cannot keep away from conflicts, divergences, and individual differences. How do you manage or handle such situations like this?
In those times of conflicts at our workplace, it is very inevitable for us to encounter this kind of situation. During these times, might be due to opposing positions, pride, competitive tensions, ego, jealousy, performance discrepancies, and the like. In these times, I define an acceptable behavior suitable on both parties. It requires honest communication, and I act as a bridge between them. It is a must to come to an agreement that is beneficial to both parties. If there is a need for the employees to undergo a tedious decision, they can be submitted to grievance process.
So, how about applying your financial and entrepreneurial skills? What can you say about it?
In a Good Samaritan salary we have received from this work, from this very noble work, I need to engage in the financial literacy. It is very important so as this new trend will help us to invest even in small business.
Um, Regarding policy making, you play a huge part in the nursing service management. You are involved in policy making. So what are your contributions or roles in this committee?
As part of the nursing management team, we comprises the decision makers and the policy makers of the nursing service management. Our expertise, my expertise, and experiences for the past years are great help to contribute in the creation of policies and implementation of different procedures adapted to the hospital setting.
Last, what is your message to your colleagues, to other nursing administrators? What are your suggestions, your expert insights about administration?
I will leave a simple note to my fellow administrators, especially those who are new, and even those who are stay longer or stay long in their position as nurse managers. We should always look back to our subordinates, learn to listen to their suggestions, their opinions, whether it is good or bad in our hearings, so as to be able to communicate well. And it is not just we are learning from what we are being studied and from our experience. We are also learning from their suggestions and their behaviors that are being manifested in their everyday life as nurses here.
That's all, sir. Thank you for sharing your time and expertise. Thank you.